Good day, viewers. Welcome to our very first episode on mental health. Today we're focusing on drug abuse. My name is Russell Chiweshe. I am your host right here at Emergency Rooms 24. On my left, I've got Dr. Kajau. On my right, I've got Oscar Pambuka. Dr. Kajau, kindly introduce yourself to our audience.
Thank you very much. Welcome, audience. I'm Dr. Kajau, a lecturer at University of Zimbabwe in the Department of Mental Health. By profession, I am a clinical psychologist, a mental health specialist. I'm operating at 144 Herbert, which is a private clinic where I see people suffering from mental health issues, including drugs. I'll tell you more about this as the conversation progresses.
All right. Thank you so much, Doc. Nkoma Oscar, please kindly introduce yourself to our audience.
Okay. Repetition for emphasis. Oscar Pambuka is a broadcast journalist, and I say good evening, good afternoon, good morning to you viewers, whatever time it is, depending on the country you're watching from. I'm a drug survivor, as well as a content creator and a communicator. And specifically, I'm here to unravel the issue of drugs, which is a menace in our society.
Thank you so much for that. Doc, what is mental health?
Yes, matter topic hombe ilikunya kuaffecta vana vechidiki vakawanda they've been affected. Mental health muchidimu tingati state of mental health, well-being, state of well-being inosanganisira physical, inga social, kana moral or anything. Zvinofana kunge zviri balance. It distills down to what are the things that constitute mental health. So you are looking at the way people think, you are looking at the way people feel, the way people react, and even the working of your body. These things work together.
Yeah.
As kazhinji kana zvichanda together zvinoshanda mwiri unyararo paine kakuwirirana pakati pezvandiri kufunga, the way I feel, the way I react, and the working of my body. But zvinoitika ndezvekuti ndikasangana nezvinhu zvinondinetsa muupenyu zvinoita upset order yekushanda kwatiri kuita iyi. Saka unozoona dzimwe nguva munhu akutemwa nemusoro, dzimwe nguva munhu akutanga kufungisisa inogona kuresult into depression iya inotaurwa, kana anxiety, kana in particular munhu anenge akufunga kuti nditize dambudziko randiri naro iri, regai ndizviponese nekusuta madrugs. Kana asuta iye ana achifunga kuti ari kuzvibetsera zvotopedzera zvawese nokuti zvinhu zvinokonzera dependence, and iye pachake is no longer a free person. Watomujeri munhu iye nokuti upenyu hwake hwese hwangokutongwa nemadrugs. Tichakona kuenderera mberi.
Okay, thank you so much for that, Doc. Nkoma Oscar, can you kindly tell us, in your view, mental health when it comes to drug abuse, or to your own understanding, chirimborichi, even according to what Doc just
you know what, Doctor laid it clearly, especially viewers. Vazhinji tinowanzofunga kuti mental health kupenga. Andimanzwa Doctor achitaura indaitozvifungo futi. So it has been defined that mental health is an imbalance mu mental state, physical state, ne social being yako. Saka during my era, I'll give my story as an example.
Sure.
I was married for 9 years, and in the 9th year, I encountered a nasty divorce. It was so painful to me. I did not communicate that particular episode to anyone. I kept it to myself, and I started living in solitude. That was a disaster for me, because ndakatanga kuzviita isolate. And during that time, my network of friends changed, the associations. So, when you're depressed, you tend to have a few friends. So my new friends became the illicit drug called Mtoriro. It became like a painkiller. Sekutaura kwamachitwa na doctor kuti vazhinji users vanofunga kuti zvinobatsira, and ichokwadi. During those 6 years under the influence of drugs, there was no other solution I wanted other than that. And the definition yapiwa na doctor, if it was yesteryear, tichiwaona nevakawanda vari kunzewo kwanorova madrugs vanenge vachitoseka doctor vachitaura so kuti doctor vari kutaura kuti chiko. You see, there's a lot of resistance. I was one of them. So I'm just here to share my story, to exchange notes with the experts as well. It's important that you have created such a platform because this is a national disaster. And we salute you.
Thank you so much for that, Koma Oscar. Doc, can you kindly relate drug abuse and mental health? Affect and I say, how does one affect the other? Or how is one influenced by the other?
Drug abuse and mental health, these are intertwined. If you listen to Oscar Achitaura, it was after divorce. Then he started mad drugs. Kazhinji one begins and the other one follows. We cannot tell which chinotanga. Kuti mumwe anotanga nemadrugs kuda zvakonzerwa nebiology nemagenes kana neenvironment paanenge ari kuwani kwaari. Right? Kana akuita madrugs, then he develops mental health. And sometimes as signs and symptoms yezvinhu zvaanenge achisangana nazvo ingaa depression kana anxiety kana from other causes, this can lead that person to start madrugs achifunga kuti it's an escape from reality yemaproblems anenge ari kusangana nawo particularly at the time.
No, thank you for that, Doc. Koma Oscar, back to you. As a survivor, how can you put it across to our audience in terms of how your experience was pertaining to your mental well-being?
Okay. Before the 19th of January 2023, Oscar Pambuka was mentally unstable. On the 19th of January 2023, I was arrested. That became a blessing in disguise.
Wow.
I don't think there was going to be a remedy which was going to help me because I never listened to anyone. So prison became a turning point. Why? Number one, there are no drugs allowed within the premises. That's most importantly. Number two, before 19 January 2023, my weight had decreased from 71 kgs to 51 kgs as a result of the intake of the drugs.
Wow.
So I went into prison in a 51 kg. Nituma oi so ndakamona tunsero waizia. Saka pandakasvika. There was noise from the other inmates. But the next thing was a statement. Ko Oscar Chi. It was unanimous what they were seeing. I did not know what they were seeing. I thought I was okay. I thought individual. But when I asked them now, they revealed very sad stories. Oscar wawonda. Oscar wakuita unge mna nopenga. Ndozoita unge munu news. I never hearing news. Look, chiko chakuitika pauri. Those were powerful impartations as introductions. Ndichipinda mukati me prison. We've got psychologists in the prison. They helped in counseling us. There are many inmates who have passed through the corridors of prison, some under the influence of drugs, some serving years, like 5 to 10 years. So they were there before we came through. And guess what? They told us what we're going through. And it happened exactly like how they prophesied. They said after 3 months, the mtoriro would have evaporated from the blood.
Okay.
Number two, your appetite would have regained. Sorry, very sorry for the platform.
No worries. Okay.
So prison, instead of Mazepnex, look at the diet a druggie takes. A druggie does not eat protein, carbohydrates, vitamins, and all sorts. No, it's junk food. My chips, my Zepnex and all sorts of things. Doctor, while it's outside, we're spending 2 weeks without sleeping. That is the effect of mtoriro. 2 weeks, oskapambuka kamuka. Asingarare, asingatsinzinyi, asingaita sei nemtoriro iwowo. You see what is happening? Zvaizoti doctor, wairara unge chituna. Waipedza kana 3 days. Wakavata. So these are some of the effects of mtoriro. Before ne after. Kuprison ndakatanga kudya beans.
Protein gang.
Doctor, zvakandibatsira.
Yes.
Wow.
From 51 takadzokera pa 60, pa 65, 71. Indotenda Mwari ndakagara 1 year. Saka 1 year yakandibatsira doctor kuti zvibude. Kubuda chaiko. Ini ndakatangira pambanje. From Banje I went to Skunk. From Skunk I went to cough mixture, PP, ne Brongo. Then from Brongo I went to Mtoriro. Chicha ikonzeresa kuti ndite move from one stage to the other. Banje dzokuta dzanakatanga nadzedzi. It was now feeling like it's light. Inopesera yajairika muropa. Zvekuti wakuda chimwe chinodhakwa chiri pamusoro.
Wow.
So that was the journey. And I'm saying to anyone, it's actually sad for one to embark on this journey in my drugs. Whether you're watching us from home as a viewer, it's a no-go area.
Yeah.
Get it from me. So I'm coming to you to tell you, to testify and teach you something good. Especially the youths, you are the vanguard of the future.
Yeah.
So if you take the drugs now, Anita, my doctor and then the journalists, the economists, Teta Gadrama zombie.
Yeah.
So doctor, I salute you for partnering with this initiative.
Wow. Thank you for acknowledging this.
Wow.
Right.